This FERNE National Journal Club educational video discusses dizziness, vertigo, the HINTS test, and the medical literature. It is relevant to our ED discussion of patients with dizziness and vertigo in an attempt to successfully diagnose and treat serious central etiologies. And we're going to talk specifically about the HINTS exam as compared to MR DWI testing in the acute vestibular syndrome patient. My name is Ed Sloan with FERNE.org. More to follow on FERNE later. So the question is, can an MRI just be done in the acutely vertiginous ED patient? How does HINT testing compare to MRI DWI testing in posterior stroke detection? So we have a study by Kata that addresses HINTS testing versus MRI testing. And the conclusion is that HINTS may detect early stroke before MR DWI changes occur. This study had 101 acute vestibular syndrome patients who had HINTS testing. 75% of the etiologies were central, 25% were peripheral. HINTS testing was 100% sensitive and 96% specific for central stroke. Skew was seen in 17% of patients and most often was related to a brainstem lesion. MR DWI at less than 48 hours was false negative in 12% of patients, so therefore only an 88% sensitivity. We know that skew predicts brainstem lesions in AVS, and skew was found to be particularly helpful when the head impulse test was negative. So this study tells us that HINTS is more sensitive than MR DWI early after posterior stroke. So going back to our question, can an MRI just be done? How does HINTS compare to MR in posterior stroke detection? In fact, HINTS detects central etiologies for acute vestibular syndrome, and HINTS is more sensitive than MR DWI, 100 versus 88%. HINTS includes the head impulse test, nystagmus, and vertical skew, which we know detects brainstem lesions. So we conclude that HINTS is a necessary part of the ED evaluation of dizzy patients with vertigo. Again, my name is Ed Sloan. I'm FERNE President and Board Chair. I have no financial conflicts. Please go to our FERNE.org website and our YouTube channel for more content related to the care of patients with acute dizziness and vertigo in the ED, and follow us on social media for more up-to-date information on the care of all patients with neurological illnesses, injuries, and emergencies, FERNE.org. If you have comments or questions, please email us at FERNE.org@gmail.com. Thank you, and have a good day.